because they don't have HLA transplant immunology lab, they are referring cases to other hospitals who perform this HLA test. So for most of the nephrologists, it is their dream to set up of transplant immunology, and they are very much curious to know how much space required to set up a transplant immunology lab, how many trained staff required, what are the equipment, instruments required to set up a, so many nephrologists they have curious to know how to set up a lab. So I think Dr. Ankit Mathur will clarify most of your doubts. So he is additional medical director and Rotary TTK Blood Center, BMST, Bangalore. Sir, please.
Without wasting time, I would like to directly go ahead. This talk is not much technical, more of administrative and management related talk, like sir said, how to set up a lab, what kind of space requirement, what kind of equipment required, that I would like to discuss. Anyway, I see many people are anyway going, so and waiting for lunch, so I can quickly try to finish it. Since morning we are discussing about the HLA complex heterozygous chromosome number 6, which is responsible for our self and non-self recognition as a self and non-self, and trying to build the immunity or immune response against the antigens which are coming to our body. So these are the various HLA tests which we do in our lab, in transplant immunology lab. This test is keep on increasing. This list is keep on increasing, and we are keep on making our life more and more difficult. So these are some of the tests are cross matches. Some of the tests are only antibody related tests. The red the tests, these are the new tests. Some of these things we discussed in the morning today, including epitope analysis. And the second category of test is HLA typing. So we have two sets of tests in the lab which we do. One is antibody related test. In this antibody related test, some are cross matches, some are only antibody tests. And second category is HLA typing, which could be high resolution or low resolution HLA typing. So when we think for a HLA lab, what is the expectation from HLA lab? What kind of transplant program we have? What kind of number of cases we have? What's the volume of this test? What's the volume of this? What the kind of number of tests we are going to have? This we will be in mind. Then we decide what kind of test, what kind of setup we can have. What is the clinical requirement? Are we focusing only kidney transplant, or we have a bone marrow transplant also going on? In this geographical area, there is any other lab doing this test, or whether there is a cadaveric transplant going on, or this kind of information we need. What kind of manpower we have, the technical as well as the clinical or the medical requirement what we have from the human resources concerned. And finally, of course, what kind of finance we have, what kind of budget we have. So I can categorize these the labs or the setup into three categories: the low volume, medium, and the high volume. Or I can say the basic when we start, where the most basic one when we start as the HLA lab with the number which is 20 or 30 or below 50 transplant in a year. That kind of setup if we have, maybe this is not in a metro city, maybe in a tier 2, tier 3 cities like a Warangal or in Hubli, Dharwad area in Karnataka. So in this kind of center, when you start first as a HLA lab, these two basic tests we need to start with. One is CDC cross-match, another one is HLA typing. So these are the two tests we can start with. CDC cross-match doesn't need much of infrastructure. HLA typing we can do with the SSP based method, which is a basic molecular based HLA typing. Other tests, whether it is flow cross-match or Luminex based test, can be outsourced. At this moment of time, we are talking about a basic low volume HLA lab. And the budget required for this test will be around 15 to 20 lakhs, or maybe less than this. For CDC cross-match, as we are discussing, we need a blood sample. We need to isolate this the sample of the donor, and we mix with the patient and donor sample with these kind of consumables. What Dr. Rajeshwari mentioned, we have a terasaki tray, we have a positive control, negative control. These are the consumables required for this test, and this kind of setup we have for CDC cross match, and then we interpret it whether the CDC cross match is positive or negative. So along with the CDC cross match, we can start with the SSP based HLA typing method. Dr. Nija mentioned about different methods of HLA typing, which is SSP is the most basic and DNA based HLA typing method. We have a blood sample, we extract DNA, we can do this DNA extraction manually at this in this lab, because this is a basic lab, no much of equipments available here. We have kits for SSP method. We don't have to have our own primers and probes in this lab, so we can buy some kits and have a master mix given by the kit. We have amplification. We use a thermal cycler. We do the amplification, and after this amplification, we see which well has amplified product, and with the help of gel electrophoresis, we analyze which HLA type, which HLA antigen is present in the donor and patient, and we can do A, B, D, maybe DR and DQ also we can do with this method. So this is about SSP method. Like I said, we have a primer given by the manufacturer. We amplify and we see at the help of gel electrophoresis. This is a rapid and sensitive method, and at a time we can do one sample. This is not a infrastructure which needs lot of samples at a time. So this is about what kind of infrastructure need to set up these two tests. I am talking about CDC and HLA lab. Still we are in the basic low volume HLA lab. So we need 2 to 3 rooms, maybe just a partition also. How to divide this? One is for serology test, another one is for our molecular biology test. So NABL has given standards for molecular biology test. So to reduce the contamination of DNA, we have to have partitions from your DNA extraction to the amplification, and finally the post amplification area. So with this kind of setup, the basic setup, we can do these two tests. Equipment required for CDC cross match, we need only 2 major equipment. One is inverted microscope, another one is centrifuge. So this centrifuge is, we need some centrifuge which run at different speeds. So we have to talk to the vendor what is our requirement for the speed, then we select the centrifuge. So these are the 2 machines required only for the CDC cross match. For SSP based HLA typing, we need thermal cycler, which costs just 1 or 2 lakhs. Gel electrophoresis and gel dock system, another costing around 3 lakhs or something, and some Hamilton syringes and pipettes are required for this kind of setup. Consumables, we have to keep buying the reagent which we need for CDC cross match or SSP based HLA typing. Manpower, we have to, like CDCs, we understand it's a labor and a manual test. You need a skilled and experienced person to do. We are dealing with Hamilton syringes, we are picking very low volume in the pipette, so we need a person who can do the test skillfully. And we need a person who can interpret the test, not only just reading the test, as well as a clinical correlation and finally reporting of the results. So next level of test, when you want to expand your HLA lab from the basic to the medium volume lab, you can add flow cytometry in your lab, and with the CDC, additional of CDC and HLA typing, we can add flow cytometer in the lab, or if required, we can share with other departments with hematology as a facility. Still, any other tests which are related to Luminex, we can outsource at this point of time. Flow cytometer, the cost starts from 40 to 50 lakhs and goes above that. But the basic one starts from 40 to 50 lakhs if you want to invest in flow cytometry. So sir, describe how this flow cytometer, the cross match works. I need you to go in again in the detail. Whenever T cell and B cell both negative, we say negative cross match. When both are positive, we say positive flow cross match. If only B cell come positive, we say class 2 HLA antibodies. We need a lymphocytes, so live cells for this. Cell viability is a question. So the people who are working for the cell isolation, they have to be expert in doing the test. Equipment required first is the flow cytometer. Manpower, a definitely trained person who has the knowledge as well as the training expertise doing the flow cytometer. We may not need any additional room for this test. This can be shared with the serology lab, or if we are sharing with hematology lab, that's fine. Consumables required, we need extra these CD3 and CD19 which are required for the for this cross match. More than the manpower room, we need technical requirement is validation of flow cross match is very important, and setting up for your cutoff is very important. So we are discussing since morning, talking about flow cross match is easy, but setting up the flow cross match in the lab is not really easy. Very few labs still in the country who can do a very good flow cross match. The next, when we want to upgrade this lab from CDC, HLA typing, and then flow cross match, the third lab which we can have is a high volume lab, maybe more than 100 transplants or 200 transplants in a year, and a lot of samples coming around. So we can have a basic CDC, flow cross match, and then we can add Luminex at this point of time, and the Luminex again costs 50 lakhs plus. We can also add high resolution HLA typing in this lab with the help of NGS. NGS system again costs 1 CR plus. So in this test, apart from doing having a Luminex gives the liberty of doing so many tests together. Dr. Shruti was talking about HLA like PRA screen, so we can do PRA screen, single antigen bead assay, SSOP based HLA typing from Luminex. But if you want to add NGS in the lab, you can do high resolution HLA typing with the help of NGS as well. So when we have this kind of test available, it's easy for us to do virtual cross match and epitope analysis if we have high resolution HLA typing available, that Dr. Firoz was describing us beautifully about epitope analysis, how to do. And with the help of virtual cross match, disease donation cases, it's become easier for us to allocate organ for certain cases who are highly sensitized. So, like Madam mentioned about HLA antibody screen, this is with the help of Luminex. We have a pool of some antigens provided by different pools in class 1 as well as in class 2. And we can only say whether antibodies present or not present. And at this test, from this test, we do not say which antibody, like whether it is A24 or B44, we cannot define, but reasonably good with the good sensitivity, we can say patient is sensitized or not sensitized. Then we can do single antigen test using this using Luminex, and we can identify unacceptable antigen. And if we have HLA typing of the donor available, we can do virtual cross match, which is helpful in cadaveric as well as paired kidney program, as well as risk assessment, and if we want to monitor desensitization also. So this is how the single antigen bead result comes. And virtual cross match, we all discussed what are the benefits of having a virtual cross match for especially for cadaveric transplant. There are n number of literature available now which says what are the benefits of doing virtual cross match for living as well as cadaveric transplant program. From Luminex, we do HLA typing on the basis of this technique called SSOP. Similar to SSP, we have a kit available. We do DNA extraction. We have a master mix. Instead of having gel electrophoresis, we use Luminex to read the probes. So and then we get our HLA typing. This is called low to intermediate, or we can say intermediate resolution typing with SSOP. So if we have single antigen typing and single antigen test and high resolution HLA typing available, and nowadays we consider high resolution HLA typing is more or less essential or good to have in a kidney transplant program also. Being the cost of high resolution HLA typing going down, is better to have high resolution HLA typing for solid organ transplants as well. There are many literature says high resolution HLA typing in renal transplant is important. It is correct assessment of donor specific antibody. It is required, or it is helpful. So it is good to consider high resolution HLA typing even in this level of HLA lab. For that we need some sort of next generation sequencing system. You can have Illumina or many other NGS platforms available. So with the help of NGS we can do high resolution HLA typing. There are some other new generation tests or some new tests which we discussed in the morning. These are the two tests, either to find out whether HLA antibodies are complement fixing or not, or finding out non-HLA antibodies. So these are the other tests which can include in this lab. With epitope analysis. Epitope analysis not an extra test. It is just an analysis of HLA typing using some software too. So any HLA lab will have a challenge on its own when we talk about cadaveric transplant, which is a suitable cross-match technique. In the limited time, we need a reasonably sensitive test to find out this information, to do the transplant or not to go ahead with the transplant. And not only just a transplant, organ allocation wise, it's very important to select which technique we should have on the transplant. So whether the flow, CDC, or any other technique of cross-match, we have to decide. We good to consider nowadays virtual cross-match for the cases who are highly sensitized. Not only just setting up a lab, the infrastructure or the machines or the people, overall quality management system of the lab is important. So NABL has given standards what we should follow. So environment, the documentation, equipment, the calibration, measurement of traceability, all these things are important in the HLA lab. Not only just having the machines and the people in the HLA lab. So document control, management, handling of error, having internal audit, MRM for the lab, training of the people, and assessing their the evaluation, temperature regulation of our system or the freezer, refrigerator where we keep our reagents. So all these things are important for the HLA lab. So NABL, like I mentioned, they have given the standards to have the HLA lab. All the HLA lab, we are supposed to follow these standards and get NABL accreditation. So if your lab is very low volume lab, it's difficult to maintain these standards and getting NABL accreditation. So in the NABL in the standards, they have given standards in 3 forms. Pre-examination process, what we should have, we have to have a sample acceptance or rejection criteria, identification criteria. All these standards are related to pre-examination process. In the examination process, we have to have the process or test which we do have to be validated in-house internally, and we have to use some internal quality control test. And not only internal quality control, we have to participate in the EQUAS program wherever it is available. If it is not available, we have to have some inter-laboratory comparisons going on in the examination process. The post-examination process, we need to have a policy how long we are going to retain the sample, the historical data. We need to analyze with the information, the historical data, and we should communicate. We have to communicate with with this information with the clinical department. So these are the 3 areas where standards are given, and we have to follow these standards. So basic QC, we have to keep in mind every test has own positive control, negative control. These values have to be checked with every test and have to be validated every time. Whatever reagents we consume have to be kept in a place where this temperature control is required. So with the summary is, whenever we want to set up a HLA lab, first we need to understand what's the need, what's the expectation of this HLA lab, what kind of transplant program we have, whether is a living, cadaveric, do we have a basic transplants going on, or we have a highly sensitized patients coming up. With the help of whatever test we have, we will to build up a testing algorithm. So this testing algorithm will be combination of different cross-match and antibody testing test. And finally, careful analysis of these tests are important. Of course, we need to see the cost effectiveness of our test and our equipment when we want to set up a HLA lab. With this, thank you so much. I hope I finished on time. Before time.
Thank you, Dr. Ankit. It was a wonderful talk. Most of the clinicians, me also being a clinician, we hardly look into the hardware aspects of a lab. The cost effectiveness is something which is we are very much questioned about. So when we are coming up with a transplant program, the transplant program improves or progresses the way it is, then the organizations are happy with it. If the transplant program doesn't progress the way it has to progress, the cost effectiveness is something which comes into question. So the one thing which I wanted to know from you is, once you set up all this lab and your program is not working well, is there a way we can use this hardware for some other investigations so that
Yes, yes. At certain point, yes. At certain level, yes. Like I mentioned, they say if you move from the basic lab, basic is a very basic kind of setup. So your inverted microscope, centrifuge can be used for any other the hematology or biochemistry test. That's not absolutely not a problem. Microscope also can be used for somewhere else. In fact, the major equipment, which is the flow cytometry, can be used for various different applications. So yes, the Luminex is something which is used primarily for the transplant immunology. But if your center is a research based, there's several research based tests can be done with the Luminex. But yes, this and coming to the NGS plenty different applications, not only just HLA typing.
Another thing is, what is your take on setting up of your own lab in a hospital when you're taking care of these patients, or sending this to these investigations to a seasoned high volume lab? This is always a conflict with the clinician.
So if we are looking for ROI kind of like investment and return, then okay, having a low volume lab is difficult to manage. And like I mentioned, the reason I wanted to draw attention towards quality management system. Say just a machine getting this some funding from so and so, having some system in place is not enough. You have to run the system with the certain standards and the quality. So it is good enough to run the system, fine. If not, at certain level, better to outsource this to somewhere. At least the quality, if the quality of test is not compromised any which ways. That's the.
Thank you so much. Thank you so much.
Any questions from audience? Yeah.
The question, just a comment on putting up a lab on your own. So we have done that. Why did we do it? Because we wanted.
But if we want things in our own way, like we are trained, if I want to do all the dilutions, I want to do everything, then I go and tell the lab that, oh, I want this, I want that. They will say, no, economics doesn't allow us to do so much. Like Dr. Handu was saying that we are doing all dilutions. When you do that, your reagent cost really doubles up. And at the same time, I know this because we have a standalone lab which is NABL accredited. We have gone for quality. 5 of us nephrologists have put this together. Why? Because we were not getting quality and we were like, we want to use it on our patients, and ours is a high volume multi-organ transplant center where hands and pancreas and heart, lungs, everything is done. But I think people, dedication, machinery is the easiest part of everything. Maintaining it and having it progress with the and getting, I feel NABL accreditation is a must, because it refines your lab every time there is an inspection. You add to the refinements and you get better and better and better. So I think putting up your own lab is a good idea, but you have to have trained people, you have to have dedication who's there in the lab all the time.
That's the reason I wanted to keep this quality equipments, or anybody say कि क्या setup चाहिए, क्या budget चाहिए. That's not enough. You need people who are trained, qualified, trained and competent. So then you have your lab and with the standards to follow.
I think the trained people, technicians particularly, is very important part of this whole the lab. As we are struggling with dialysis, we have so many dialysis centers now. We don't have dialysis technicians. I think training of the technical people is the most important, and then particularly maintaining also. So as an nephrologist, I'm comfortable treating the patient, but I need people who are trained and who can take care of the lab. Whenever I order, they should be able to give whatever information.
Just to add, we actually don't have good technical staff. Technicians are not available who are really skilled. The kind of the educational system we have in the technical level, they are really bad. So this is somewhere we need to really work on.
Is there any platform to train these people? because we need to have structured program or structured curriculum for these people to be trained by some what you call authentic institute, university or something like
See,
that.
I don't think there's any educational like qualification something which is only for HLA and transplant immunology for technical stuff. I don't think we have any, but we are, with the help of Ishi, there was a movement to start some sort of program in this area for technical as well as for medical stuff.
Actually, they conduct workshops, madam, every year. At one institute they conduct hands-on workshop, like for 15 days, like this. They can, anybody interested, they can participate. And setting up of transplant immunology lab, the basic they can start with CDC cross-match testing. Any small hospitals also, basic if they can start CDC cross-match, like it requires only one microscope, Hamilton syringes, pipettes, and for the storage of antiserum, one -20 degrees, refrigerator. So anybody wants to set up, they can start with basic CDC test, and they can slowly add on molecular test. So if they set up CDC test, the initial they can send molecular test outside, and once slowly they can set up their own molecular labs.
So thank you, sir. It was very crisp and very clear-cut ideas, steps you have given how to start an immunology lab. It was a very clear message. Thank you, Chairperson.